Okay, before entering the patient's room, I'm going to go ahead and grab the machine I need. I'm going to use the Metaneb today. I'm going to check the patient's charts and make sure I have everything I need, medications, and any adapters that I need. The Metaneb can be hooked up to a trach, have a mouthpiece, or have a mask. So I'll also need to know like if the patient is compliant or not, or alert and oriented. So then I'll go ahead and enter the patient's room. I will introduce myself and I'll go ahead and let them know that the doctor had ordered a Metaneb device, and that is to help with three things. One, secretion clearance, lung expansion, and aerosol delivery of medications. So I'm going to show you here. Here's a Metaneb. There's three different devices here. I want to explain. Right here is the aerosol delivery. We'll do that for 2.5 minutes. We'll start them off there first. Then we could go to continuous high flow oscillation, and with that we can go ahead and make them work a little bit less or harder. Meanwhile, we can increase the flow, and that's going to increase flow is directly proportional to pressure, so that will increase the pressure. And then after we do the continuous high flow oscillation, then we can go down to continuous positive expiratory pressure, and that's going to be like the easy PAP therapy. So the Metaneb really does the 3-in-1, and the most important thing that we're going to be watching is definitely the patient's tolerance and their mouth seal, if they're using a mouth piece, and then also their pressures here. So we want it to be at least in a therapeutic range, above 15 centimeters of H2O, or in between, like the 20 there. So before and after therapy, before I would check their breath sounds, listen to them, and then afterwards listen to their breath sounds. We should definitely be watching for any, to see that it was actual help. We can look at their work of breathing, if it was increased work of breathing or decreased work of breathing, and then listening to those breath or lung sounds and breath sounds, and seeing if anything diminished, any crackles, or if they were breathing a little bit easier afterwards. Yeah, we can use, let me show you here, we can set it up. We can go ahead and deliver just regular saline in there, or we can go ahead and put, if they need Zopanex or a Duoneb or something like that, we can put that in the medication part there. There's different adapters. This can be set up to the, if your patient's on a vent as well, and you just hook it up to the wall. So let me show you. Have it an adapter. I don't want this to fall on the floor. Okay. Adapter is hooked up to the wall. And we can start off on just aerosol therapy here. So I'll go ahead and turn it on the top part here. You can see that I was reaching pressures around 10. I can increase the flow. If I increase the flow on there, you can see when I breathe. It's a little bit harder to breathe. And then if I decrease the flow, look at my pressures. Get it close up to 20. Go ahead and show you on the continuous high flow oscillation. That's on a low flow. on a higher flow. Just changing the amount of oscillations on there, and then I'll go ahead and do to continuous positive expiratory pressure, the easy tap. So you can see when I increase the flow, the pressures, when I had the high flow, it was easier for me to hit the higher pressures here. When I went to a lower flow, I was getting around 10. So protocol on that is you go ahead and do the neb for 2.5 minutes, the continuous high flow oscillation for 2.5 minutes, and then the continuous positive expiratory pressure for 2.5 minutes. Okay.